Good evening. This is Skokie Institute of Allied Health and Technology. My name is Dr. Kaiser. I today am going to be presenting to you a short webinar, 10 to 15 minutes, talking about November 2018 important dates, which are regarding Alzheimer's disease and diabetes prevention month. We all know that November is famous and is known for Alzheimer's disease prevention month and also for diabetes prevention month. So a little bit about our institution. Skokie Institute of Allied Health and Technology, we are a nonprofit education organization, and our main purpose is to provide the community with hands-on training, education leading to economic independence and entry-level positions. We specifically focus on career development, career training. We are an online institution, student-centered and community-centered organization. We're also the biggest thing that separates us from other online institutions is that we are career focused. Second, we are student focused. And third, that we are affordable, flexible, and we value our students and their career training more than anything. Right now, fall and winter terms are starting soon. Fall's term has already started. It started October 15th. Now, winter term will be starting this month on November 12th. You can register, and when you register, you can receive free tablet. The tablet will be tablet of your choice that you are looking forward to, and you can save on tuition. We also offer scholarships, but in order to apply, the student has to contact the executive director, which would be me, at this email address. You can also visit us at http://siaht.org. If I go into this website, this is our website that you will be basically going on. You can contact me here or the school. Anyone from the school will reach out to you, and we will then help you with the admission process. In order to find out the process of admissions, you can go here, look into our programs, you can actually go here. Tuition and financial aid, you can actually go here, and then free job placements. We provide with free job placements to our students, which is something a lot of other institutions charge you for, but we do not. So now let's go back to our topic. We are discussing Alzheimer's disease. What I will do is that in this small webinar, I'll first talk about Alzheimer's, and then I will then talk a little bit about diabetes. So Alzheimer's, when you talk about Alzheimer's, you first want to make sure you know what is dementia. So what is dementia? It's an impairment of brain function, which is intellectual function. Basically, the function or the part of the brain that is very important for us in order for us to do our daily activities, meaning getting up in the morning, making breakfast, washing our face, taking a shower, getting ready for work, getting our kids ready for work, for school, going to work, knowing where to go, knowing where to drop our kids in the morning, remember where your house is, remember what to do if you have the urge to go to the bathroom or the urge to eat. Mental disorders are caused by the changes in the brain. And basically, the patients with dementia, they look confused, they look disoriented, they're confused with the person they're dealing with the place they're in, or the time they're looking at. It's not a normal change in aging. That's one thing we need to understand is that dementia is not a normal condition. Even for aging process, it's not normal. What is Alzheimer's disease? So now when we come to Alzheimer's disease is a progressive nervous disorder that eventually destroys all mental and physical functions. So basically, it's dementia, but it's basically advanced dementia. So 10% of the population in America suffers from Alzheimer's, and it affects both men and women of all racial types, economics, and social groups. So, what are the causes of Alzheimer's disease? Basically, not known. We basically do not know the obvious cause. The different theories. Now, I could go on and on about this, but my main purpose is to educate the community about what Alzheimer's is so we can better understand it, and then we have family members, we could better help them. So I will not be able to go through the whole detail. This is something you would learn if you are registered with our institution and going through our program in fitness and in any of our programs, nutrition, medical billing, pharmacy technician, as you would learn in detail about this. So there are different theories. Genetic is a big part. Researchers have found that having a close relative with Alzheimer's increases a person's risk of developing the disease. Then at age 30, because he or she is aging, there's 50% chance of developing Alzheimer's. A person who has had one parent having the disease has 36% higher risk, while if there's a person who has both parents suffering from Alzheimer's, they have 54% of the risk. Signs and symptoms. Basically, it has a gradual onset. First clue is the change in person's behavior. Forgetfulness, which in the beginning is mild, but then it leads to problems like an irritation because the person starts getting irritated, finding the right word, inability to recognize objects, inability to use simple objects. So the stages of Alzheimer's disease, basically the early stage, the person has communication difficulties. They can't use the right grammar. They have difficulty pronouncing word. They don't want to change or groom, and then they overreact, meaning they get stressed really quickly. The middle stage is it may last for 2 to 10 years. This is where the person with Alzheimer's becomes restless and they just keep on pacing or wandering because the fact that they cannot remember things, they have communication difficulties gets that person really irritated. They, at this stage, may need help with many daily tasks, like dressing, bathing, using the bathroom. Caregiver may have difficulty as care becomes more and more difficult as the stage progresses. And then the late stage usually lasts from 1 to 3 years. The person will need 24-hour care, like in a daycare or in a nursing home, and they basically become bedridden and become incontinent. So this was a little bit about diabetes. Now I want to talk a little bit about Alzheimer's. Now I want to talk a little bit about diabetes. So diabetes basically is a condition or a disease which is high blood pressure, high blood sugar that needs to be managed as it becomes a chronic condition. It's the high blood sugar that occurs in those with diabetes, and basically it's due to the fact that pancreas is not making enough insulin, or the cell of the person with diabetes do not respond to insulin, and it's one of the 10 top causing leading death causes of death in the United States. Diabetes and a chronic condition of diabetes, which is uncontrolled high sugar or sugar that's been in the person and the person has been dealing with that high sugar, can cause blindness, non-traumatic lower leg amputation, stroke, heart attack, kidney damage, and periodontitis. So they start having, they can have stroke, they can have a heart attack, kidney damage, or they also have inflammation or the damage of their gums. So there are different types of diabetes, and since this is just a webinar, I'll just talk a little bit about each of those types. We have type 1, type 2, gestational, and then the other types that are now known to public and to physicians and researchers is LADA, MODY, which is maturity onset diabetes of youth, and secondary diabetes mellitus. So type 1 basically is in which the onset of high sugar can happen really quickly. Your symptoms are increased urination, tiredness, weight loss, increased thirst, hunger, dry skin, and blurred vision. The causes basically can be genetic and environmental, and treatment basically includes control of sugar and carbohydrates intake and insulin. Type 2 is previously was called as non-insulin dependent diabetes or adult onset diabetes, and it may occur in 90 to 95% of all diagnosed cases, but it usually begins as the insulin resistance, a disorder in which the cell do not use insulin properly. It also, as the need for insulin rises, the pancreas loses the efficiency of producing insulin. So this can happen in older age, obesity, if you have a family history of diabetes, if you have had a history of gestational diabetes, or your body does not metabolize glucose well, physical inactivity, and it can also occur in race and ethnicity. So now gestational diabetes is this is a form of intolerance. It's not really diabetes, but it's intolerance that is diagnosed in some women during pregnancy. It only occurs during pregnancy, but women who have gestational diabetes, they have 80% chances of becoming diabetic later in the life. So gestational diabetes occurs more frequently among African American, Hispanic, American Indians. It can also occur in different other races, like in Asians, Southeast Asian population. It is most common in obese women and women with a family history of diabetes. So what happens is that during pregnancy, gestational diabetes requires the treatment to normalize maternal blood sugar, and it in order to avoid complications in infants. Basically, because the there's glucose that's not being digested well, and there's too much sugar that the child is getting through the placenta. LADA is known as latent autoimmune diabetes in adults. It's a form of autoimmune, which is also known in other form is type 1, and is diagnosed in individuals who are older than the usual age of type 1 diabetes. So you can also call it as low onset type 1 or also type 1.5. Often patients with LADA or LADA are mistakenly thought to have type 2 because of the age of the diagnosis. Then MODY, which is maturity onset diabetes of the young, is a monogenic form of diabetes. And basically it has to do with the genes that controls the sugar and diabetes condition. Mutations in one of the several forms or several DNA cells that produce the enzyme that controls sugar causes the person to have MODY. That enzyme is glucokinase, and it's produced from pancreatic cells that produce insulin. And since there's a mutation or there's something wrong with the gene that produces this enzyme, therefore the person does not have insulin, or the person produces insulin which is being produced but is inefficient. So diagnosis basically in earlier when it was known and it wasn't that common, was based on the presence of non-ketotic hyperglycemia, which is you have high sugar but you don't get a condition which usually occurs in diabetes, which is ketosis. So therefore, it can become dangerous because again, it's high sugar that needs to be controlled. So the awareness months, November is Alzheimer's disease prevention awareness month and diabetes prevention awareness month. And the purpose of this webinar is to educate the community about the decapacitating abilities these diseases can cause if not diagnosed and controlled. Diabetes is one of the leading causes of disability and death in the United States, and it can cause blindness, nerve damage, kidney disease, and other health problems if it's not controlled. Connection to SIAHT. We have programs in fitness trainer, nutrition, and wellness coach. We also have allied health programs. Our program's nutrition and wellness coach and or health coach combo teaches students about health, aging, and disease, and also teaches nutrition cases and nutrition formats for clients. Student can work with nutritionists, dietetic, dietetic assistant, and dietitian, and in gyms as nutrition coaches in coordination with their fitness trainers. The programs are 10 months long and there are 4 terms a student has to take. The last class is for nutrition program is an internship in which student is provided with excuse me real-time cases, and they have to prepare meal plans for patients keeping in mind the medical diagnosis of the student, the clients. The students in fitness trainer program complete an externship that requires them to work in a fitness agency, and they gain experience in dealing with clients and monitoring their exercises and fitness level. So this webinar that we have today is actually related to two programs. Why we should you choose our institution? Because we have been awarded the best higher education uh, in 2017 and 2018 consecutively. As a student, you are studying and getting help with the best institution, also included in the Business Hall of Fame. We have an online LMS that provides the student a virtual learning experience that can be used to interact with each other and with instructors. Then a student also receives one-on-one instruction every step of the term and classes. Book, certification fees, CPR, all is included and covered in the tuition when student registers with us. Plus, we also cover the liability insurance that is required as a part of a student externship. So this is our website. I showed you a little demo by clicking on the website while we had that webinar, but you can actually visit it. You can also visit us in person by making an appointment. We have contact forms on our website that can be used to request an appointment. I hope this webinar brought to you the knowledge that a person would need to educate their community, their friends. If you have family members with these diseases, it will better help you to understand how you can help them that they have a longer prosperous life. We'll be back in December with another webinar that focuses on December health issues. Thank you and goodbye.